Hi, welcome back to Talk of the Town. Grant Cully, owner of Harbour Health Insurance Solutions, joins us today to share some critical information pertaining to healthcare reform, a topic that touches all of our lives, unfortunately. Fortunately or unfortunately, I guess. So, what is the official name of healthcare reform?
Well, the official name of the healthcare reform legislation that was passed in March of 2010 under the current administration is the Patient Protection and Affordable Care Act. I like to reduce that a little bit and abbreviate it and call it the Affordable Care Act because it's sort of something that people don't understand, the Patient Protection Affordable Care Act.
Right.
It is all, though, healthcare reform, and a lot of people refer to it as Obamacare.
Yeah.
Obamacare, Patient Protection Affordable Care Act, Affordable Care Act, it's all under the same legislation. Don't get confused. It's all the same thing.
It's one and the same.
Right.
So how will people be able to, I guess, assess their options for health care?
Okay, they're going to form exchanges. And the exchange in each state will have exchanges. Some of them will go over state lines and things. But the individuals will be able to go to these exchanges, which is the marketplace for health insurance information. It allows individuals and small groups to go into an online system and look at what is available out there, who's participating in the plan, what the products are, the cost of the programs, and they'll also be able to find out if there is any subsidy available for individuals. If the individuals do qualify for a subsidy towards their health insurance program, they will have to purchase through the exchange.
So do you, I guess, personally feel, or as an insurance agent, do you feel this is an advantage to the patient or not?
There's a lot of advantages to it.
Okay.
There could be some disadvantages, but most of those are probably financial disadvantages and the cost that it's going to rack up for the government, and the government, of course, being the people. So we will have to probably pay more. But the big advantages are, number one, first and foremost, is for people who have been unable to get insurance in the past. They will not be excluded or declined. They will be able to get the same health insurance plans at the same price as the people who were able to buy insurance before. And that's a big advantage. Insurance companies won't be able to decline them. They won't be able to put any pre-existing conditions on them due to medical conditions that they're treated for currently or have been treated for in the past. Another big advantage is the affordability. People have not been able to afford insurance in the past. And for people who are at certain income levels, there will be subsidies built in to their insurance that they can actually purchase with subsidies from the government.
And you said that they can actually get that type of information online to know if they're eligible for subsidy or not.
Yes, the exchanges are basically a mechanism for the individuals to go online and look at that. Those exchanges will be available October 1st, 2013.
Okay.
And if you enroll through the exchange, you will get coverage effective on January 1st, 2014.
Okay, so people that maybe have not been able to obtain insurance currently, they still have to wait till the exchange is available, then i.e. January 2014, when they can actually be insured.
That's exactly right.
Okay.
But they can go onto those exchanges and find out the cost and enroll. They can also enroll outside of the exchange.
Okay.
I kind of look at the exchanges as being what I have done for almost the last 30 years, believe it or not, that I've been in this business. I go out to the companies or the individuals and I show them all the products that are available, show them all the pricing, the benefits that match up to what their needs are, and consult with them. That's kind of what an exchange will do.
Right.
You will still be able to use your agent or healthcare advisor to buy insurance. It's not that you just have to go through the exchange, but those who get subsidy it will be necessary for them to go through the exchange.
Right. You know, I'm an employer, as you know, and we have lots and lots of questions, Grant, and obviously we only have a short amount of time here today, and I do want you to come back on to speak to us. But if people, employers such as myself, have questions and they obviously need them answered regarding healthcare and the direction it's going in and what the costs are going to be to us as business owners, can they call Harbour Health Solutions and be able to get those questions answered?
Absolutely.
And give them a direction?
Yes, we can give them some direction, we can give them information, we can help them out with those needs, just as we have in the past. They can give us a call. I think our phone number's up on the screen.
As is your
website. Or they
website.
can also look at the website, WHHIsolutions.com. All of our individuals are trained and qualified, and we try to keep up with this because exchanges, healthcare reform, the Affordable Care Act, it is changing daily.
Yeah,
a lot of the decisions are being made on a daily basis.
Yeah, Grant, thank you so much for joining us today. All great information. We appreciate it.
Thank you, Sandy.
And we thank you so much for joining us on today's Talk of the Town.